particular, as the name of today's event suggests, women's health unmet needs through cooperation and excellence. I would like also to give a special thank you to our hosts here in the Parliament, who will obviously take the floor shortly and who will contribute actively to this discussion. I want to thank all the experts who have joined today's event. And obviously, I would like to thank ESGO for promoting this initiative. If we want to have a comprehensive vision on health as a priority across all policies, we have to include and pay special attention to women's health. Women are living longer than men, but they are living in poorer health. The gender gap in health has very high socioeconomic costs, and we need to address it. Better health for women brings prosperity and a more equal and just Europe for everybody. So despite women representing more than half of European citizens of the European population, their health needs remain chronically underserved. Gynecological cancers are emblematic of this neglect. Access to prevention, diagnostics, and treatment remains fragmented, and women in Central and Eastern Europe continue to face significantly poorer outcomes than those in Western and Northern regions. To address these persistent disparities, ESGO has developed a position paper which will be illustrated in the course of the meeting of the roundtable in the next couple of hours. And the paper sets out a series of recommendations which we would like to bring to the attention of decision makers and all stakeholders, and which demonstrate how its work can effectively contribute to reducing inequalities in women's cancer care across Europe. I also would like to pay reference and submit to your consideration the forthcoming Gender Equality Strategy 2026-2030, which will be also illustrated in detail by a representative of the Commission in a few minutes. And as part of ongoing reflections on Europe's health priorities and the upcoming discussions of the multi-annual financial framework. In this context, attention to women's unmet health needs have never been higher. The political momentum at the European level presents a unique opportunity to rethink women's health in a comprehensive and coordinated manner. So, going straight to the agenda, I would like to anticipate that in the next couple of hours approximately, there will be interventions, starting with Dr. Andriukaitis here, who will set out the situation, set out the scene, and then we will move to an expert panel discussion and conclude with remarks that aim at launching a call to action that ESGO is submitting to everybody's consideration. So without further ado, I would like to thank everyone, ensure that this conversation is as lively as possible, and moreover, that we are able to address and focus women's health issues, notably those that have got to do with gynecological cancers, in a way that brings the due attention to policymakers and the forthcoming policy initiatives that the Parliament and the European institutions will undertake. Thank you very much. Dr. Andriukaitis.
Thank you so much. Thank you for your very kind words, and thank you for allowing me to be host. It's always very easy to be host. It's not. It's very difficult to organize, to invite, to encourage, to see. But to be host for us, for European parliamentarians, is very simple. Raising some plus, and we are doing. But generally, let's go. Event is so timely and so important. Because as you know, women's health has many aspects, cultural aspects, societal aspects, human rights aspects, religious aspects, and so on. And when we are discussing, for example, between our political groups, where is the best place to discuss women's health strategy, you can see that in Sant Committee, we have no big majority that can support us to present comprehensive women's health strategy, very comprehensive one. And then we are discussing, maybe it is better to discuss those issues in FEM, in FEM committee, not in Sant Committee. Why? Because some clear dividing lines. If you are touching abortion rights, reproductive rights, and then you see dividing lines. And it means, it always creates a challenge for me, because why we are seeing such dividing lines if women's health is, first of all, a human right. 100% human right is litmus paper. When you are looking into societies, putting women's health question, you see society is democratic or not, respecting as a whole human rights or not, or choosing some human rights and saying, no, others it's not, it's up to, And especially when women decided to make abortion, it's up to them to decide, not up to society to blame or to forbid it. It is unacceptable in 21st century. And now we are here, we are discussing gaps, inequalities, a lot, because we know very well how it's interrelated with cultural, religious, and of course, educational level of societies and so on. Okay, for sure, women's health is increasingly recognized at a European level as a strategic priority now. We see this clearly reflected in several key policy processes currently underway. The preparation of the next EU gender equality strategy for 2026-2030, reflections on the future EU health priorities, and I see Romana, she is very fighter. Please trust Romana. Romana, she is a real brilliant leader. It's my first and last mandate. I will retire because it's, for me it's enough. 79, it would. I am, mammoth, it's or dinosaur. But she is leading, and I was very happy that she presented cardiovascular strategy, very much stressing issues about gaps in women's health. And of course, she is also doing a lot with oncology. And once again, and today, I know that she is one of the participants. And of course, discussions on the next multi-annual financial framework. Please be active, colleagues. We are fighting to have standalone program for health. Standalone program. We are proposing minimum 10 billion euros exactly to EU for health program, and exactly to including women's health into it. If we will lose this battle, we will stay like today, meeting by meeting, forum by forum, because if you look into Commission capacities to cover all priorities with money, you can see that some priorities are not covered. Why? Because we are losing battle in front of MFF. Next MFF is from 2027, will be approved in maybe at the end of this year or not. But I am encouraging you, citizens of European Union, please be vocal. We need to say health is what's absolutely priority, not only security, not only defense. Where is European Health Union, colleagues? We have so big sector, but we are so silent. Okay. Together, this debate reminds us that choices we make today on women's health will shape the resilience, fairness, and sustainability of our health system for years to come. For years to come, colleagues. Women's health is not a niche topic and not a sectoral concern. I think that women and men health should be aligned. I can't separate human papilloma virus from men and women. I can't. It's impossible. We need to vaccinate both children and girls. How can you separate it? From an organizational point of view, I have no chance. But I see how big is gap. Why we are prioritizing women? Because gap is so challenging to all of us. It's painful. It is clear, it is clear measure of how well our health system responds to complexity, chronic conditions, and inequality. And while we have made important progress, significant disparities still persist across prevention, across diagnosis, across treatment, and across outcomes. And it is a pity that it depends on where women are living, on geography. Medical desert, geography, situation, it is in our European Union. It's not in the third world, in our union. They have a challenging situation because if women are living in some small rural areas in south of Italy, for example, or in north of Lithuania, you can see that they have absolutely different situation, different opportunities because they are living in such place. It's up to us now to organize the situation. In gynecological cancer alone, more than 270,000 women are diagnosed every year in the European Union. Yes, yet survival rates still depend on far too much on geography. We all know that prevention tools such as HIV, human papilloma virus vaccination, are not implemented evenly across the member states. Okay, this is why the experience of European reference networks. I know that you just are ready to propose networking, and I'm very happy. Now I see that the European reference networks has more and more understanding and more, attention, because we see that it was well done. We overcome national barriers. We overcome nationalism in our healthcare systems. Healthcare system is member states' competence. No, it's wrong. It's absolutely wrong. National, insurance, budgetary capacities, yes, we can allow. But generally speaking, treatment, prevention, vaccination, and all other issues are international. I always argue very nice word. I learned word from one excellent my friend. He told, look, you have word international and domestic. But please keep in mind that the best thinking way is to have intermestic. It means that international and domestic must be combined. Or thinking globally, acting locally, but keeping in mind that we need to overcome those challenges and barriers. That is a philosophy. And of course, European reference networks make us to realize, to do it in practical way. When we launched this in 2017, I was very happy. Now you see, now we have 1,627 centers of excellence in more than around 400 university hospitals. But of course, interconnectivity, interoperability is so weak. We need stable financial mechanisms which should guarantee connections between, not through emails or mobile phones, but through real functioning infrastructure. And you are proposing the same. You are proposing to have to establish, as I see collaborative women health centers across. Excellent idea. Excellent. Let's do it. Let's help us. You know that we just organized last year in December, we organized big 3 days meeting inviting European reference networks, biobanks, authorities, AI factories, and so on, proposing to build pan-European ecosystem for research and investment. And we signed a declaration. And you know, the message is simple. Excellence, coordination, connectivity at European level are essential to reduce inequalities, to deliver better outcomes for patients, and to including women facing complex health conditions. For sure. Against this backdrop, the proposal presented today by ESGO for an EU-wide ecosystem for centers of excellence for women's health should be seen as a natural evolution of the European way of working. And thanks a lot for that. It applies to logic of structured excellence and networking into an area where inequalities remain particularly pronounced. Importantly, this proposal builds on what already exists. Accredited centers, established clinical networks, recognized quality standards, and ongoing new initiatives in cancer, in health and in research. It does not seek to create parallel structures, but rather to explore how existing strengths can be better connected, scaled up, and sustained over time. I can stop here. I can listen to you. I can read. I can study, because I'm a very big fan to establish such ecosystem, to strengthen European reference networks, to propose an ecosystem for research, investment, innovations, and to implement this freedom of movement of knowledge, research, and investments. As Letta proposed, as Enrico Letta proposed. It is our way. We need to do it, and we need to do it now. And then we will see to establish such fifth freedom test infrastructure, which covers all activities which are in your hands, because you are doctors, scientists, excellent specialists. The floor is yours. Thank you.
Thank you very much, Dr. Andriukaitis. I think your words are so clear that we cannot imagine a future without Dr. Andriukaitis in health policy discussions at European level, but clearly the fact of ensuring that the European Health Union remains a fact, and that EU for Health remains also a pillar of all the strategies, all the priorities, I should say, that the European Union has, brings, and I'm quoting you, to decisions for years to come. And that's why it is so important to converge on a number of actionable decisions that are part of the proposals and part of the discussions we are having today. Dr. Andriukaitis also presented another word, a new word, that's a neologism, intermestic. I'm taking notes. So if perfect. So if there is no copyright, we can use it also on your behalf. But seriously, proceeding on the agenda, now it is time for a representative of the European Commission, Greet Vermeulen, who is online at DG Justice, who will help us also understanding the evolution of the direction that the strategy that is being drafted on gender equality, how this can connect to women's health, and how it can also leverage the knowledge, the important issues that are part of today's discussion. So if Greet is online, the floor is yours. Thank you.
Thank you very much. Can you hear me? Okay. Health is really one of our most valued treasures, and I'm really...
I
Is there an
thought
issue
I
with
saw
me?
her.
Hello? Hello?
I can only add in the meantime that in the political guidelines of President von der Leyen, there is a reaffirmation that gender equality remains a top priority for EU's current mandate. And building on this, the Commission already published a roadmap for women's rights. This happened in March last year, and this is being followed now by the EU Gender Equality Strategy 2026-2030. Have we established the connection with Great Vermeulen?
Hello? Can you
Thank
hear
you.
me?
Yes, we can. Go ahead.
Okay, thank you so much. And thank you very much for involving us in this discussion and reflection. And it's really, as I already said, it's a very timely moment to kind of discuss these issues. Health is really one of our most valued pressures, but there are still big differences, big inequalities, including gender inequalities with regard to health in generally, but also access to healthcare. And this is an historical issue, but it has become very increasingly clear that we often overlook differences between women and men when it comes to research, treatments, medical care, and medical conditions. For instance, biological differences affect diagnosis, response to treatments, and rehabilitation, and they've often been ignored. Women have been excluded as research subjects, for instance, due to the hormonal cycles, which could entail a potential unpredictability, and women's health issues have been under-researched. And then also in historical data sets, sometimes used in algorithms, they're often not disaggregated by sex. So this could result in women's misdiagnosis or late diagnosis, sometimes too late, because relevant symptoms and complaints are ignored, or the medicine in question is not as effective for women. So different symptoms, for instance, for a heart attack is often a kind of a frequent quoted example. So such failures in women's healthcare cost women and society dearly. This is where mainstreaming gender in health policies is key if we want to ensure adequate treatment and medical care and keep our societies healthy and resilient. So this is therefore, we need actions at different levels. And I think this is a very interesting topic to discuss. The member states are really crucial. They are in charge of the provision of healthcare and the organization of healthcare systems. But also at European Union, we can kind of add certain elements on it. And in March this year, the European Commission adopted the Roadmap for Women's Rights, which we call our guiding compass for gender equality. And principle 2 of this roadmap focuses on ensuring the highest standard of physical and mental health for women. And it promotes that the gender lens should be embedded in all health policies and actions. The roadmap sets out a long-term vision for achieving gender equality based on these key principles. And in the Commission, we are currently preparing, as already announced, the next gender equality 2030, which will contain a series of actions and measures for the coming years to do. In October of this year, the roadmap was endorsed by the 27 member states, the European Parliament, thank you so much, as well, and the European Economic and Social Committee and various stakeholder groups. And this really shows the commitment that they adhere to the declaration and the principles, including this principle 2 on women's health. And this will allow further discussion on how to tackle women's health in different pressures. We need to ensure this gender mainstreaming in the health domain, including in financing and setting up mechanisms that ensure that the gender lens is included in research, development of medicine, training of medical doctors, other medical staff, and the overall organization of gender responsive health systems. And I think we are at a very important moment to reflect on these things, also with the discussions of MFF, kind of to really show how this is done and how we should pave the way forward. When we look at research, quite often this gender lens is needed and is done. So that's why we really try to, in the promotion of our EU-funded Horizon program, we really try to ensure this commitment to gender equality when it comes to different research projects, but including health research. The goal is really to ensure gender equal working conditions, but also to include this gender dimension in the research projects. So there are three main levels at which this is included in the Horizon program. So projects should have a gender equality plan, the integration of the gender equality into research and innovation content as requirements by default, and then setting up also gender balance in project boards, expert groups, and evaluation committees. There has already been research, like for instance, on the social and medical impact of menopause, but I think more research is needed. And I think it's really also important to reflect also very carefully how this gender dimension is included also when using artificial intelligence. Secondly, with regard to sexual and reproductive health and rights, this is included explicitly in the roadmap for women's rights. The roadmap refers in this context to respectful and high quality obstetric, gynecological, antenatal, childbirth, and postnatal care, free from discrimination and combating harmful practices, kind of, as well as access to affordable menstrual hygiene projects and contraception. Under Article 168 from the treaty, the member states are competent for the definition of their health policy and the organization and delivery of the health services and medical care. This includes this SRHR, but the EU has the competence to encourage cooperation between member states to lend support to their action and to complement national policies. Moreover, the Commission monitors development in member states and encourages also to share good practice example and sets up also specific projects to ensure cooperation and development. We also need to take into account the gender dimension in disease management in general, and the Commission is mainstreaming gender in health policy, for instance, in the Beating Cancer Plan, and also complements this with funding from the EU for Health program. So it's also including the gender dimension in the recently adopted cardiovascular health plan as well. But going deeper a little bit on the Beating Cancer Plan, it really tries to have this comprehensive approach, looking at prevention, early detection, and it was already mentioned before. For instance, there's a recommendation from the member states in 24 to the member states to kind of ensure vaccination, including the human papillomavirus, to kind of really make that kind of more widely available, and to have new approaches also in cancer detection. So by this, the Commission will give support to member states to ensure that 90% of the population who qualify for breast cancer, cervical cancer, colorectal cancer screening are offered such screening by by this year. And then another point of that plan is also to ensure quality care, including effective therapies and supportive care, including also the financing aspect through social protection systems for member states. And the last thing is really also to kind of really share knowledge development and think further how to advance, including through cooperating and finding the best way of organizing care. So it's a really good moment to reflect on the further steps from a financial point of view, but also to try and reflect what would really help to further advance women's health and taking women's health seriously. As I said, we are currently preparing the next in March of this year, in which this gender mainstreaming element is very relevant. But I'm very much looking forward to hearing from you a kind of your concrete suggestions on how we can really tackle it and what would really help very much for women's health, and in particular gynecological cancers and how to tackle them. So very much looking forward to your suggestions and the debate, and hopefully we can stay in touch for further exchanges. Thank you.
Thank you. Thank you, Great Vermeulen. This was really encouraging, and you will definitely have very tangible, concrete suggestions. I think it was very helpful and very important that you framed the gender equality strategy in a way that connects different dots. It is a holistic, it's a comprehensive plan which takes into account the health dimension and the women's health dimension in particular. I forgot to say that there will be time for questions after the panel discussion. So if you can bear with us, and great if you can stay a few more minutes, there will be perhaps also a possibility to further discuss with you on the work that you are carrying out. Now, I would like to welcome Anne Middelaar, who is the co-chair-elect of Engage. And Anne will bring the patient perspective in the discussion, highlighting unmet needs in women's health, in gynecological cancers in particular, and how these issues require a policy response and require also specific care pathways which are informed by lived experience. So Anne, the floor is yours.
Thank you for giving me the opportunity to contribute to this very important initiative. My name is Anne Middelaar, and I am the co-chair-elect of Engage, the European Network of Gynecological Cancer Advocacy Groups. I'm also the chair of VZW-Gincas, a Belgian patient organization for women with gynecological cancer. And I am also a cervical cancer survivor. In December 2018, I was diagnosed with stage 3B cervical cancer, and at the time, I did not fully realize on how much my outcome depended on something patients should never have to worry about, whether the system around them is ready. My local hospital worked with high-quality standards and a strong multidisciplinary oncology committee. I received guideline-based treatment quickly, radiotherapy, chemotherapy, and brachytherapy. And because I live in a country where these treatments were accessible within weeks of my diagnosis, that timing contributed directly to my survival. In 2021, I relapsed. A tumor was found in the lower lobe of my left lung, with affected lymph nodes in the upper one. Again, I experienced what good care can look like: timely surgery by an experienced team, structured follow-up, physiotherapy to rebuild my breathing and strength, and the support even to reintegrate to work. I was treated not only as a diagnosis, but as a person rebuilding her life. But through Engage and through my conversation with other women, I learned the hard truth. Not everyone in Europe and even in Belgium had the same chances that I had. The differences within the countries and between European countries are enormous. One of our members in Greece waited for 2 months even to receive the results of her PET-CT scan. A member of Albania told us that not all cancer treatments is reimbursed, and that access to radiotherapy, crucial in advanced cervical cancer, can take months. And in some settings, supportive care is almost non-existent. This is why when we speak about unmet needs from the patient perspective, we mean the gaps that prevent women with gynecological cancer from receiving timely, equitable, understandable, and holistic care. Care that supports physical, emotional, and practical well-being throughout the entire cancer journey. Let me be concrete. First, equal access to medicines and treatment, because all women's survival should never depend on where she lives or what she earns. Second, access to specialized multidisciplinary cancer centers, because outcomes are better when care is delivered by an experienced team with the right expertise, volume, and coordination. Third, early detection. For example, ovarian cancer still lacks effective population screening, which means many women are diagnosed late when options are fewer and outcomes are so poor. Fourth, better healthcare literacy and patient-centered information, because patients can only make informed decisions when they truly understand their diagnosis, their risk, and the choices they can make. Fifth, comprehensive supportive care, including psychological counseling, physiotherapy, pain management, and sexual health support, because survival alone is not the finish line. Quality of life is a part of the treatment. And finally, peer support and strong patient organizations, because they are often the lifeline for women who feel unheard and unseen. They break through shame and silence, offer connection and courage, and carry patients' voices into the room where decisions are made, turning lived experience into real change. So the message in name of Engage and all its members for today is simple. Europe has the knowledge, the treatments and the standards. The remaining barrier is equity, and equity is a policy choice. If we are serious about closing the gaps in women's health, then we must ensure that every woman, regardless of where she lives, has the same chance, the chance to be diagnosed in time, treated without delay, supported through survivorship, and heard with dignity. Because unmet needs in women's health are not small gaps in the system. They are gaps in protection, in fairness, and in opportunities. And closing them is not only good healthcare policy, it is what Europe stands for. Thank you.
Anne, thank you very much. You, as always, you said it beautifully, and at the same time, you set out a very clear agenda of actionable items that have to be taken into account in an action plan, shall we say, at pan-European level. And again, the inequalities dimension justifies even more the call that Dr. Andriukaitis made at the beginning. We are one Europe. There should not be a difference based, as they say, on the postal code. Thank you. We will get back to your perspectives. Now, let's continue and conclude the setting the scene stage, so to speak, with the president and the president-elect of the European Society of Gynecological Oncology, Anna Fagotti, on my right-hand side, and Jahid Sehouli here, who will give us really a sense of the strategy that ESGO has set out and which is submitting to our attention and to the attention of decision makers, and which ends up with very concrete policy recommendations and a call to action. In particular, and of course, I'm not going to take anything out of your talks, there is a vision for the establishment of an integrated EU-wide ecosystem of centers of excellence for women's health, which builds on the existing experiences and therefore strengthens even more the connectivity with the comprehensive cancer centers concept, which is already well established on the European agenda. Anna, the floor is yours.
So good afternoon, everyone, and thanks a lot for hosting ESGO here. I think we met with some of you in the past, and thanks for everyone who gave this excellent contribution. I think I don't have very much to add to what has been said already. However, as I prepared some slides, I need to do it, but it will be very, very short and probably like a summary on and with some data on what you have already said. So if I can have the first slide, please. And in the meantime, I just want to highlight the fact that at the end of the story, this is a very complex topic, as you said, which takes into consideration so many issues. And we are trying here to be as much holistic as possible, as much comprehensive as possible. So the first slide is not this, I think it's another one before, but in any case, I just want to highlight that fragmentation in women's health and pathways of care is a reality in Europe, as we know, and as we have seen. So we have the consequences which are really visible, and I just want to mention some of the examples. So these are the results of this kind of fragmentation for women's health. As you said, we have fragmentation in HPV vaccination and screening programs. We have a long and unequal waiting list for having any kind of treatment. For example, around 20% of patients wait at least 2 months before having any kind of treatment for their cancer. And then we have also another important point that we can touch is insufficient and inconsistent training in Europe in highly specialized field like our gynecologic oncology. And if we can have the second slide, please. This kind of fragmentation has also a clinical and financial impact. And the clinical impact is, of course, related to delayed diagnosis. And this means that patients go from one hospital to another. They are submitted to multiple diagnostic examinations, which are not diagnostic at the end because they are not treated by specialists in their field. And therefore, this has a very important economic burden, of course, and brings also to an impact on emergency care, because at the end of the story, if they are not diagnosed, they will finally go to an emergency room. They are also undertreated or suboptimal treated, even from the clinical surgical point of view, as you said, and indeed they receive suboptimal surgery, which means a higher rate of postoperative complications or higher rate of post-treatment complications, even in terms of not quality treatment for radiotherapy or chemotherapy and so on. And this has also, again, a financial impact. So as you can see, anytime we have not a good health system, this has a double burden in terms of quality and in terms of financial impact. And also there has been like a study showing that in the overall burden, a financial burden for cancer treatment, 50% is related to this kind of postoperative of post-treatment complications, access to emergency room, or even a financial burden to the families and to the caregivers or to the patients that have to run from one place to the other. And also this has an impact on their everyday job. So may I have the next slide, please? So what's our proposal? Because we are coming to the end, and then I will give the floor to my president-elect. The proposal is the establishment of these women's health centers of excellence in Europe. This is not something which wants to be developed as a single activity, but wants to collaborate with something which already exists in Europe, like, for example, the comprehensive cancer centers, like the EARN centers, like the Jane initiative. So we have so many initiatives in Europe, and we don't want to compete. We just simply want to offer what we are doing since a long time, more than 20 years. What we can offer is actually the accreditation system that is working throughout Europe for cancer center treating gynecological diseases, mainly gynecological cancers. Of course, we have more than 200 centers that we accredit by our own. And this accreditation is based on quality indicators, which are very clear and very and evidence-based. We are also running training for our fellows in this kind of subspecialty. And probably you know that, for example, gynecologic oncology is not recognized throughout Europe. So we have some countries where you can have this kind of trainings, and others where you don't have. So having a curriculum which is recognized at the European level makes training equal for everybody, and therefore treatment is equal for all women. We also have developed some databases, so we can also collect data from our patients. We have now a very large, I think the largest database in Europe for ovarian cancer patients, more than 12,000 patients with ovarian cancer, which we can analyze from different perspectives. From one side, to give more precise treatment, of course, but also to see whether there are differences in Europe. We have made very recently with my vice president a very interesting analysis in East Europe, for example, where we found that the access to innovation, and especially in molecular diagnostic for gynecological cancer, is available in East Europe only in 30% of all patients. So you can imagine that 2 of 3 actually don't have access to this system, and therefore this means they don't have access to molecular treatments related to molecular diagnostics. So it's like a chain. If we don't start, we will never have an answer. So with this word, please, Jalit, go ahead.
Yes, so first of all, again, thank you very much hosting the European Society of Gynecology, and only to give you some feelings in the background. So our society working since 43 years, and now we are with you because we need your support, and we understood the system needs moderation and it needs alliances, because there's money enough in the room, but there's no money for moderation and to see the patient journey. And this is a defragmentation, and this is what I really love, because women health, and I love what you said, it's a human right, but it's even a quality indicator. It's a value indicator for every healthcare system. There's no doubt. But the question is, and even I'm coming from Berlin, everything is there, but there are still many, many women, they're excluded from the healthcare system because lack of moderation and lack of looking on the patient journey. And this is our comprehensive holistic approach. We talk about prevention, but prevention is not paid. Cervical cancer is 100% preventable disease. This knowledge is at least 50 years old. But what is the consequence? So I love this call of action, and this is the reason why after 43 years, the European Society of Gynecology understood without an act with the political supporters, it's impossible to change the system. And I hope even with the European Commission to change even the German system, because it's not good enough. And it's the same, and that's the reason why we really like to implement these. And I've been 8 years a co-chair with the advocates. We learned as doctors, as professors, we can so much learning from the advocates, but even they need professional environment and structures, education, empowerment. We implemented them in our guidelines, but it's a process, and it's not nice to have. It's a must, and therefore we need structures, and we need this partnership. And so we really touched by our heart, because we never thought that women health is a human right, because for us as gynecologists, it's taken for granted. But you are right. But if it's a human right, then let's work together to change the system. Because again, we have opportunities to prevent, but we don't use them. And for me as a gynecologist, I'm trained to become a surgeon, but I want that the patient live long. And if you look on cervical cancer and endometrial cancer, we can cure them if they detect early, but they will die for cardiovascular disease, and they are excluded from the long-term survivorship program because they don't look on the cardiovascular risk. The same is for breast cancer, 10 to 20 times higher lung cancer risk, but the program are still looking organ, they are still defragmented. And this is a shame, and lets us use our approach to look on education, on training. We are targeting the young doctors to give them a different attitude and to learn from advocate and to bring them from the beginning, not if we talk about quality of life or long-term survival, we have to understand what are the goals and what are the needs and what is the effect of the patients if we treat the patient. What's about financial toxicity? What's about time toxicity? And it's relevant for the patients, it's relevant for the medical staff, for the medical system. And this is our offer to work with you on these status. We are looking on research to bring even research to the woman, but we know even in Europe, there are still regions, there's no access to evidence-based medicine. And in general, we need at least 5 to 10 years to reach at least 1/3 of the women with the new results of our clinical trials. And I'm really proud that the European Society of Gynecology made it, that we work together in clinical data, in real-world data, but even to think about the responsibility to change not only the microenvironment, the global environment. So I think the center of women health can be really a tool to break the old fashion. Do you know how many people are involved in one woman with ovarian cancer if they did surgery? What do you think? So you're the most experienced person in the room. So what do you think? How many people are involved in one woman with ovarian cancer surgery, 2 weeks in the hospital? What do you think?
I think it's about 15, 17.
It's always good that we learn every day. So it's at least 160 people,
What?
but nobody knows.
Of course.
There's no structure. It's a direct and indirect. So even the pathology, they are at least 6 people, but there's no platform. They interact. And everybody telling me it's my patient. No, it's her own person. And so the structure from what we have, surgery, lab, gynecology, they are defragmented and they do actions to the woman without asking her, and they are not transparent. That's the reason we need structures to think like we did it in the beginning with diabetes, disease management programs. That's teams who are dedicated to women health. This is the key. It doesn't matter where they come from. And this center can try to bring the same attitude and to moderate. And this is what I said. We have countries, there's no pap smear or HPV screening. But I can tell you honestly, in Germany, they do, after hysterectomy, they do at least 1 million euro every year to do a pap smear without any nonsense. They do it because it's paid. And this, I think we have to change. And our offer, next slide, please, is to think really on a holistic approach. And we have several groups to do prevention, primary, secondary, tertiary prevention, to think about our guidelines. So we learned that we cannot do guidelines without bringing patients from the beginning into the guidelines. And so even the topic, and this is what Anna Fagotti and all the colleagues did. So this is our agenda. So we will have in a few weeks our agenda 23.5 and political activities, even to address our science into the community, but even in the political area is one of a key issue, independent of election of 2 or 4 years. So this is something what we like to offer. And I know it's a long way, but we are ready as European Society of Gynecology. They are very motivated. They have more than 3,000 members. They're really the key opinion leaders. We made it. We brought them together. It's heart to heart, it's eye to eye. It's not like the pyramid we know from the old session, but we need this partnership with you. And we know that it's a difficult time. Money is limited, but I say always it's enough money there, but we have to moderate them. And let's work together. And even I have seen Figo, Frank Luverens, one of a close friend of mine, because we are looking even with the people and with the institution who are on the way since many years, but they are still separated islands. Let's make bridges and let's become ESGO as one of the driver, because again, it's a shame that we have so much knowledge, but we don't bring it to our patients. So thank you very much.
Very, very compelling messages, both from Anna and Jalid on behalf of ESGO. So the buzzwords here are an ecosystem of centers of excellence for women's health. I would like immediately to proceed to the roundtable discussion with the experts. The experts who are invited today represent different areas of knowledge. There are scientists, there are clinicians, there are public policy experts and advocates. And since you mentioned Professor Lowen, whom we have online from Frankfurt, I would like to give him immediately the floor because he also has limited time available, again, with the understanding that there is a Q&A session. So everyone, including obviously the president and the president-elect of ESGO, will be able to answer questions and be part of the discussion. And I am saying this for the benefit of all the participants today. Frank, Professor Lowen, the floor is yours. Please go ahead.
I hope you can hear me quite well. First of all, I think I should introduce myself with the organizations I'm representing. EBCOG, the European Board and College, is the umbrella for all subspecialties, and for sure, ESGO is one of the most important parts of our community here in Europe. EBCOG is also representing the part of women's health under the umbrella of the Union of the European Medical Societies. FIGO is the International Federation of Obstetrics Gynecology, representing all national societies on obstetrics, gynecology, and women's health on Earth. And with saying that, it is definitely actually the biggest NGO existing, not just only on women's health, representing nearby 150 independent countries on Earth. We are recognizing that women's health on the one side is becoming a more and more important issue, but on the other side, it is still seen as something like a technical term that we also have to focus on women's health. Please recognize that women's health is not just our duty, but it is easily described by saying half of the world is female and the other half has a mother. We should understand that women are the center in our families, in our communities, that women are responsible for what we are doing in our societies. So to understand that women's health is not just only another issue, but women's health is crucial, leads also to the fact that we use women's health issues like the maternal mortality to describe how a health system is functioning in different countries. And immediately we are understanding it is not just only related to the income of the whole country, in the system of the World Bank with describing a country as high or low income, but it is also describing very well the structure, the health system, how it works. And my dear friend Jalid Seouli just described how important it is to understand that we have to focus on these issues using everything what is possible in a state. That here I come to you, and you as members of the Parliament, of the European Parliament, as most important figures in the European Commission. The one part is to discuss about laws and to discuss with lawmakers. The other part is to understand that we need the engagement of governments. We need the engagement of all politicians in Europe when we're discussing on the European level or worldwide. But we also have to understand that we have huge organizations who up from now have to work together. That is, and here I'm addressing WHO and UNFPA, and I'm very proud to tell you here in that debate and discussion that now we came together. Europe, the UNFPA, the United Nations branch for health, and the International Federation of Obstetricians and Gynecologists signed for the first time a memorandum of understanding to develop these projects of women's health together. And actually, we are focusing exactly on what you are talking about, what Jalit and Anna just mentioned on cervical cancer and breast cancer. So we are developing structures for screening, for early detection, and also for connecting all different partners in the treatment of women on Earth. And as Jalit just mentioned, I just came back the last week from the Maldives. I've been there for 1.5 days to meet all parts of the government, including the First Lady and the Minister of Health for sure, to develop structures in this geographically challenging situation that you have at least 20 different islands, to bring them together and to work hard to reduce the detected tumor size in breast cancer. So these people are ready to support, and we need your support from the European Parliament to make sure that in Europe we have a better access for all women to service what is evidence-based. We are always talking about evidence-based medicine, and as the European Society of Gynecological Oncology is leading in this part. So we have the knowledge. Support our colleagues in this gynecological oncology branch to bring that knowledge to all our member states. We need you here, talk to the governments, but also support those who are the healthcare workers on the ground. Thank you so much for listening.
Thank you very much, Professor Loven. Thank you for your time, and it's always important to connect global health with the strategies that are being developed and implemented also at European level. So thanks for giving us also the global dimension. I would like to continue in this roundtable, which provides insights, as we were saying, from different competencies, and continue with the clinicians' perspective. We have the pleasure of having Dr. Lorenzia Zane from the Erasmus Medical Center. She's a specialist in oncology, of course, gynecological oncology, I mean, and you can give us also a perspective in terms of training, fellowships, and what's required from your perspective to strengthen also the capacities. Thank you.
For being here today with us. I think looking at the situation that we have at hand, if I want to focus on training alone, I think I will start with the patient and then the policymakers, because if we want to give our patient here in Europe the best treatment possible, which is actually available in most countries, then we should be ready to also have the experts ready at the locations where they need to be. So if I have a patient who has health treatment in a different hospital who comes to me, and then I have to sort of optimize this treatment, I am starting somewhere halfway that I don't most probably know what happened before, but I have to guess and skip and work on that. So why don't we look at having the patient seeing the right person at the beginning of the project, so we know where the project is going to end? And I think when you look at the Netherlands, we might be a good example for the rest of the European countries, because in the Netherlands, to become a gynecological oncologist, you need to have a full-time fellowship. Without that, you are not practicing as a gynecological oncologist. And then I think we could also serve as an example when it comes to decentralization or centralization of gynecological healthcare, because the treatment is also done in specific centers. Not all hospitals can treat some specific gynecological oncology diseases. So when you take cervical cancer, for example, in the Netherlands, you can go to 5 hospitals for the treatment. It might be for the patient a journey. Luckily, the Netherlands is a small country, so the distances are not that much. But then this patient knows they are getting the right treatment. An MRI in a different hospital, for most of my colleagues, we know what the difference is. In a different hospital, it's not the same as an MRI in a gynae oncological center where you treat cervical cancer. So it makes the challenges of being able to work with an MRI from a different center, we can take all those costs away and use it in a better way, because this patient is already having an MRI we can't utilize. We need to do a new MRI. We need to repeat some labs. So there are a lot of unnecessary costs that are being made. That is just waste of money. And we need to prioritize the patient in making some of these choices. So I think we need to work as a group in putting the woman central. I'm a huge advocate, so if you give me the floor, you have to take it back. But I think there's no one here who doesn't have a woman in the family. And the challenge that we have as women is that we have different organs giving us different cancers. So we don't have one gynecological cancer. We have the ovary, the tube, the that, and they are all different from each other. So the challenge is huge, but we are ready to take on the challenge. We just need support from the policymakers to be able to make the lives of these patients that we see perishing also better. I think I'll take the floor back later.
Yeah, well, thanks, Lorenzi. But perhaps even before giving the microphone away, there is an example that you can illustrate of good practice in the Netherlands in which you are involved, of a women's health center. Since we are talking about centers of excellence, there is something which is happening right where you are. Can you briefly tell us what that is?
Exactly. So last year, March, with a group of medical doctors, mostly women, specialists and researchers from Erasmus Hospital, we realized, I think it was just after the publication of the International Burden of Diseases, that most of the points that were made on this huge burden of diseases, we had menopause in it, we had ovarian cancer as a huge load. So we were like, there are a lot of knowledge gaps about women's health that we don't know, that we haven't approached yet. And we also know that a lot of research doesn't involve women. When it comes to drug research, if you are lucky, you have 41% representation of females in the new drugs that are upcoming. So we need to create a movement to improve the healthcare of women, not only by having meetings or associations, but also having pivots that we can move forward to say, this is what we want to do to better the healthcare for women. So we came together and we formed this, the Dutch Women's Health Center of Innovation and Research. And this has given us actually a platform to leverage with the communities on outreach programs, a platform to leverage with the government when it comes to policy making, and a platform for research that we are easy to collaborate with other universities on research when it comes to the woman. So we're not only looking at gynecological cancers, but we're also looking at cardiovascular diseases. Presentation in women is so different, but we don't talk about it. Nobody knows about it. Even when it comes to gastrointestinal problems, women experience it very different than men. So there are a lot of knowledge that we need to bring to the woman. And there's a lot of research that we need to do when it comes to the female as an entity. And that is why we set up this organization. And we hope we can be an example for other countries to also hub on and better the healthcare for women, which is very essential.
It is essential, and it is a good practice or a best practice which demonstrates that it can be done. It can be done everywhere. So we will definitely keep looking at your experience and how it evolves, because let's remember we are talking about centers of excellence, and this is exactly the mindset, shall we say, that you have had in building the initiative you have just described. Let's move on. Let's move on now. We have also the pleasure of having Dr. Nathalie Vermeulen, who represents the European Society of Human Reproduction and Embryology. Nathalie, why is it important to talk about fertility as well in the context of these centers of excellence? Thank you.
Oh, thank you, and thank you for inviting me, and more importantly, inviting fertility specialists, that is Stevo. I think as cancer treatments have improved, it has become a major component of a woman surviving, especially young women. They survive the cancer, and then where is their right to build a family? We have to take that into consideration as well. It's part of the women's health. It's part of the integrated care, the ability to build a family, to be informed of the possibilities after that cancer treatment. So that's why I'm here. We have very marvelous collaboration with ESGO. We work in our field on evidence-based care. They work in their field on evidence-based care. They work on accreditation of centers. We do that as well within our sector. But we somehow we try to collaborate, but we're not there yet with this integrated approach. And I'm very happy to be able to support that. And we have also talked here about research that has been mentioned a few times. There is also a very big gap there from my perspective. We have worked very hard within our fertility field on data collection, on collecting real world evidence to support decisions, to see what is useful and not useful. And I know that ESGO and all the cancer sector is doing the same thing. But in the current context with the GDPR regulation, it's impossible for us to integrate both systems. So that is a call to you as well, to support to get support in reducing the barriers for us to collaborate. That is why I'm here, and I'm very happy to have been able to present that message to you.
Thank you, Nathalie. Very clear as well. Now, as I was saying, here we hear from different perspectives and different competencies. And let's switch gear for a moment from the researchers, the clinicians' perspectives. There is also a public policy framework which deserves attention and which will be a platform that facilitates the integration of a number of specific recommendations, policy recommendations that originate from ESGO's work. And I would like to welcome Elisabeth Kuiper. Elisabeth, with the European Policy Center, what is the work that you have been doing in recent times to address women's health? Thank you.
Well, thank you so much, Eduardo, and many thanks to ESGO, because I think it's very important that you brought all of us today to this room. And I think for me, one thing is clear before going into your question: women's health is not lacking ideas. I think all of us have very important policy recommendations, but I think women's health is lacking coherence, scale, and political prioritization. Because apart from, of course, from the political leaders in this room, and also many thanks to the MEPs that are supporting this initiative, I think the lack of political prioritization is also a very important one that also we from a think tank perspective have been trying to address. And I think there's a few lessons that can be learned indeed from the research that we've been doing. I think the first one is funding. I think there's decades of underinvestment in women's health, not only in data gaps, but also diagnostic basis, bias, and unequal outcomes. And I think it's really important to really have more sustained investment in women's health and also have more of a full life course approach. And I think also the example that you just gave, and I think that's another lesson, is that luckily there's really innovative examples at national level, and I think you just provided one. However, I think cross-border collaboration is very important to scale up these important initiatives. Because the EU has a very important role when it comes to connecting these initiatives and make sure that indeed these initiatives strengthen policy coherence. I think from what also very clear from a lot of your interventions that data integration is foundational, because women are still underrepresented in clinical research, health data sets, and sex disaggregated data is not systematically collected or used, which in my opinion means that we're essentially policy making in the dark. So we need more data. I think also a more intersectional life course lens is really important, because intersectionality and a life course approach also recognizes that women's health really also varies across, of course, age, socioeconomic status, ethnicity, disability. And again, I think that intersectional lens is very important for the work that also needs to be done at EU level. And I think another point, and I think that's also raised by the representative from the European Commission, we need to see also women's health across different policy domains, because women's health is not only about health, but it's also about much broader approaches. And therefore, it's great news, of course, that the European Commission in March, and I guess they're going to do that on the occasion of International Women's Day, but that's my guess, is going to come up with the gender equality strategy. But I think, and that's also an important call from the paper that we've been writing, a dedicated women's health strategy is needed. And I think it's important to explain why that's needed. That's not important because health is a niche topic that needs to be dealt with in isolation, but to ensure that indeed funding and research and healthcare delivery are aligned in one more holistic strategy, and that is then being seen as also instrumental within the broader policy context. And I think a last point that I end with, the reason why that's so important is that we're living in a day and age where discussions about women's health are very polarized. It's very much seen as something that is due to also gender issues, which are also discredited by the far right these days. And I think that's also why today I'm very happy to see a lot of men today in the room, because I think as women on our own, it's not sufficient that we need call for women's health strategies. Because again, in the current political context, there is a big risk that then it's then being dismissed as, oh, that's just a gender issue and we're not dealing with it anymore. So I think my call indeed from a policy perspective is women's health needs to be embedded in much broader considerations from a health perspective, but also from an economic perspective, because we're living in aging societies and women are essential for societies, but also for the economy. So in that respect, I think there is a clear opportunity for the EU. I just hope indeed that with the upcoming initiative, the EU is indeed taking on that call and taking it very seriously. Thank you very much.
That's the perfect segue, Elizabeth. Thank you very much indeed, because you framed the picture. And now, before going back to you with additional specific questions, perhaps it is appropriate to hear the voice. It's appropriate to hear the voice of advocacy groups in the cancer community who are also trying to translate exactly what you said into the cancer policy field and obviously engaging the cancer community. I'd like to invite Marion Lot of the European Cancer Organization. Where is Marion? Oh, Marion, I'm sorry. From the experience that you have seen so far in the implementation of Europe's Beating Cancer Plan, let's go straight to something that is quite familiar, at least as a framework to everybody. What might be the most effective strategies to reduce disparities in women's cancer care, and how could these approaches be scaled across member states?
Thank you, Eduardo. And of course, thank you, ESGO, for convening this important conversation. I might repeat a few things that Elizabeth has just mentioned, but repetition is key. So I think, first of all, it's important to note that in Europe's Beating Cancer Plan, there is one chapter that is dedicated to inequalities, but there is no flagships per se that are dedicated to women's health. So there's still a lot of improvement to do. So I think my answer to your question has 3 points. So what would work best to reduce disparities in women cancer care is first, having shared gender-sensitive goals. Secondly, policy alignment that goes beyond health. And thirdly, we said it before, having some really ring-fenced funding to turn commitments into action, because we do need the money. So first of all, about creating shared goals and accountability, it really matters because the women cancer needs, they're still not addressed equally across the cancer pathway in all member states. We saw some data as well before, but we do continue to see major striking inequalities
when it comes to breast and gynecological cancer screening, when it comes to HPV vaccination, but also when it comes to access to treatment for ovarian, endometrial, vulval, all of the women-specific cancers. So to give just one example, in 2022, their cervical cancer screening coverage was 79% for Sweden and 21% in Poland. So I think the data speaks for itself. So closing such big gaps is not a long-term aspiration. It is really something that is achievable today. So we need to expand, we need to implement, we need to systematically monitor screening and vaccination programs across the member states. And this is perhaps one of the fastest and the most effective ways to reduce these inequalities. Now, secondly, I think, and we think at ECO, that cancer policy must be better connected to the broader equality frameworks. I know this is coming back a bit to the introduction, but this includes the Commission's upcoming EU Gender Equality Strategy for 2026-2030, because cancer cannot be addressed solely under this is a public health issue. Health and cancer must be recognized as a gender equality issue with actors such as DG Just, but also the FEM Committee of the Parliament being a role player in that. And inequalities in access to clinical trial, the research bias, the gaps in diagnosis and care, they're not isolated health problems. They are intersectional gender inequalities that require cross-policy solutions. So we do hope that in March, when the Commission comes with their gender equality strategy, we will see a strong focus on NCDs with actual tangible actions, because for now, this is clearly lacking in those frameworks and the past one as well. And lastly, to make these approaches work across Europe, we of course need ring-fence funding, notably in the next EU MFF for 2028-2034. And this would allow the EU and the member states to, of course, finance innovation, just as, for example, your proposal for the centers of excellence. But for now, unfortunately, and I think it's important to stress, the budget doesn't make women's health or the fight against inequalities a priority at all. And I think that we as a health community must really stand for it. And I think right now as well, this House and the Budget Committee is doing some important work in putting their proposal for the next budget. And we hope that the Sound Committee, with some members represented here, are going to make sure that women's health and cancer in general are really represented in their opinion letter that they send to the Budget Committee. Thank you very much.
Excellent, excellent, Marion. Thank you very much. And that's a clear, actionable item. And I think we are all aligned, I dare saying, that the budget required to ensure that health policy programs at large, and of course, even more so, the implementation, the further implementation of Europe's Beating Cancer Plan is fundamental. We have kickstart a fantastic program which really puts Europe at the forefront in public policy terms when it comes to Europe's Beating Cancer Plan. We cannot leave, the work unattended and leave some implementation activities, most of which are ongoing, by the way. We cannot just stop them and forget about their existence. Now, I turn to Wolfgang. Wolfgang Fecke represents the European Cancer Leagues, and European Cancer Leagues historically have been great advocates of several initiatives and programs focusing on prevention and focusing on screening, early detection, etc. Wolfgang, your angle and your insights regarding, in particular, the building of a women's health action plan with a focus on oncology. Thank you.
Yes, so thank you very much. Yes, so of course it is important that we continue the work which was started in Europe's Beating Cancer Plan. I mean, that plan is a success. I think most of the people agree with that. However, as you also just said, it's by far not finished. And some of the goals, some of the actually very ambitious goals, for example, having 90% of patients screened for cancers in a particular country, are not reachable. I think that is currently just an utopian idea. Yeah, even for countries like Germany, I'm from Berlin as well. I talked to our German Cancer Society. They tell me And this is a country which is really very, very advanced in accreditations of cancer-specific competence centers, centers of excellence, if you want, also for women's cancers. Even there, they told me that right now patients have access only to about 20% of these centers of excellence. So one big question is, even if it's possible to have these centers built in every country in the European Union, how then to make sure that the patients which are not just living in the vicinity of these centers have actually access to these services, how to get there. And there are many, many other questions related to this. So how make it sure that actually patients know that these things exist? What is possible for them? What are their rights? And of course, there are many EU-funded initiatives which really make the situation a little bit better. We were also involved in some of the projects, for example, for cervical cancer screening, where we see that especially some vulnerable groups in women in certain countries, they have issues actually to get to these centers. They don't want to go there. They often don't know that they exist. These might be migrants, might be sex workers, might be whoever, people who don't know or who don't trust doctors. Then it's very important that, and that is also the job of advocacy groups like us or ECOs, to make sure that there are national groups which work there, that they take up the challenge of working together with the patients and design, maybe co-design with the scientists, with the doctors, ways that not only there's a competence screening program there, but actually that this program also reaches the patients. So there's a lot of work to do. And when I've seen the paper, it's fantastic what was done in cervical cancer screening, at least in the pilots. There's still a lot of work to do. We'll see. And Marion also mentioned it. In some countries, there's an 80% screening rate. In some other countries, there's a 10% screening rate. So there's so much to do. But then there are all these other cancers, women cancers, which were not addressed by the EU yet. Endometrial cancers, ovarian cancers, these very cancers with very high mortality also. And the work needs to continue in the plan, and the money needs to be found there. And Dr. Andriukaitis, you said at the beginning, okay, we need to make sure that there is some ring-fence funding. And I cannot see how that funding can be found in a competitiveness fund. How can you make this competitive? I mean, I just don't understand that. So here we need to make sure that certain areas of research are maybe not competitive, but are just being done based on the evidence that achievements are far behind in some countries compared to others. Maybe I stop here.
Very clear, Wolfgang, and I tend to agree. Perhaps if our hosts have also some thoughts regarding this dichotomy or apparent dichotomy between health policy and competitiveness of Europe, and where potentially they fit together, where do they get together? To your point, again, if I extrapolate a couple of keywords, Wolfgang, there is an awareness raising program which is indispensable, particularly for certain type of gynecological cancers which are not well known. So it's a matter of public campaigning, which again is in the nature of the organization that you represent and Marion represents. At the same time, it's a matter of implementing Europe's Beating Cancer Plan. There have been recommendations on screening that have been adopted already 2 or 3 years ago, and which demonstrate that there is a willingness, and there could be even more willingness to move forward in the implementation of primary prevention, secondary prevention measures, as you have illustrated. I leave it for now, unless anyone wants to talk about competitiveness, but public health clearly is a pillar in European policies, which would be dramatic to destroy or to dilute. The fact of having, synergistic opportunities is fine, but not at the expenses of the health of the European population. That's clear. Go ahead. I picked your brain. Go ahead.
Also, yeah, I'm happy if Vytenis also jumps in there. No, when you ask specifically now on competitiveness, I know it's hard time defending the social pillar in general in the European Union, but I think also Romana and Vytenis and others, we also frame it now that we say that access to healthcare is a key element also of the competitiveness, because a society where more and more people get ill, where we don't care about prevention, where we don't care about mental health, where we don't allow access to health to the people, but then, also the economy will suffer from it. So it's directly linked also to competitiveness. That's how we now frame it. And then also with Vytenis together, we were in Kiev on mission, and you see even in difficult situation, in war situation, how important the health care system is there. I was very impressed, and I was not the only one, about how the Ukrainian health system adapted to the situation, transforming and train in a hospital, organizing the hospitals, etc. And then let's do not forget, even if I don't want that, but there are going to be maybe also some attacks to viruses, so kind of bio-terrorism. So we should be aware. And all that is about public health also. And also the very innovative, let me just say that word also on Ukraine, innovative approach they had to mental health issues. And this mental health issue they facing, of course, with a Damocles sword, I don't know how to say it, above them, and the war over their head. But I think a lot of young people, and in general, the people all have a lot of fears right now. So even if the situation is very pregnant or present in Ukraine, there are some takeaways that we can take also about the pressure that we had. Would it be about climate change, about the war on the European continent? So to tackle more specifically, and that's what we're doing also, what I say we with the Commission, on tackling specifically mental health issues. So for me, access to healthcare for everybody is a key element also of this famous competitiveness. We should not forget. Also, social cohesion is, for me, access to housing is. If we don't have any social cohesion anymore, what is going on the other side of the Atlantic? This is a society that is falling apart totally now. So also the economy will suffer. People are going to have more and more health issues and etc. I don't go too much on the other side of the ocean. Of the Atlantic. Let's stay here. But just to react on I don't see it. We should not go into the narrative, oh, there's the nice to have social pillar, and then there is the competitiveness, the important topic. No, they are very closely linked.
Thank you.
Well, I was a bit too long, sorry.
Thank you very much. And it's good to hear it from you. 1 minute.
Sentence.
Yes.
Yes, we have some proposals, exactly. First of all, we are just fighting to have standalone program on EU for health or something more. It's about 10 billion. And of course, also asking 90 billion to be put into such competitiveness fund package. It should be dedicated into all areas, because health in all policies requires to have financial means to support those instruments which are exactly concretely enshrined in every area. Of course, also keeping in mind all others. Horizon, very important issue once again. But if you are speak about competitiveness, please keep in mind that Draghi report, letter report, and Hater report. 3 big reports, including Nunes report. They're all calling about necessity to keep in mind health as big factor of competitiveness. And we can present all issues. Here I can show you, that's Sora can show you. Here you see a declaration which has 8 points. 8 points. Exactly what just you mentioned in your 8 points. I ask your president-elected to see differences. And please read those 8 points, only 8 points. Yeah. Starting with prioritize EU action plan on rare diseases, prioritize, strengthen workforce development, capacity building, European and Academy, yeah, it's the same. Equitable access to diagnostic enabled treatment, innovative drug innovation and met needs, you have. Then collaborative between academy, you have the same. And of course, ecosystem, you have the same. Clusters, you have the same. It was done generally. It can be addressed to all areas of healthcare, to all. Now we are started pushing forward to include it into ring fencing issues as building interoperability and interconnectivity. It can help to develop your centers of women health, connections and so on. I can, it is for you, those declarations. I'm just very happy that you signed signature because we are collecting signatures. And then we will send it to Ursula von der Leyen, to Costa, and to speaker, to Metzola, to Roberta. Yes, and we will press very much to keep it high on the political agenda because it's about competitiveness, investments, research, innovations, and knowing that we have a lot now new instruments. Let's see. We have answers.
Fantastic. And this is already a result. It's an outcome of today's discussion. We are fully aligned, but it's important to maintain also the gender dimension. And to close this roundtable, before we proceed with the concluding remarks, I would like to invite Meryl. Meryl, you are a board member of Cancer Patients Europe, and therefore also an advocacy group. And I think you deserve the last word in terms of patient perspective. Thank you.
Thank you. Thank you very much. And I'm a lung cancer patient, so I know well the inequalities about that. But I only can echo what Anne was mentioning, that it is awareness, that it is the lack of awareness, that there is the lack of referrals, and we all want to be treated by a knowledgeable hospital, but you don't know if you are being referred by your GP, you go to the hospital nearby, I know from a lot of hospitals that they don't refer the patients to a center of excellence, that's the money issue, because then they lose the patient. But I think if I see here the policy recommendations, well, we have work to do, but we have work to do not only in our silo, but we have work to do with all the stakeholders, because we need all the stakeholders to really have impact and to really have change, and in the whole pathway of the patients. And I think I was just reading that 80% who had significant family risk had not assessed a genetic testing. That 2/3 of women had not heard of ovarian cancer prior to their diagnosis. And I think we have work to do. And I think if we go on the front and we make sure that late diagnosis is really costing a lot of money for the society, but also for the disruption of the family and etc. That it is so much more important that we focus on that. Yeah, and well, and for the long-term responders, like some call it survivors, but I think if you have had cancer, you always stay a cancer patient, that we need to look at the fertility, we need to look at the psychosocial needs and the financial toxicity, and we need to have programs after being treated, because you are not just being cleared. So yeah.
Wonderful.
Thank you.
Meryl, thank you very much indeed. Once again, you are underlining the importance of the ecosystem and the comprehensive approach, holistic approach, which is required in order to have a patient person-centered pathway and a person-centered approach. We've got the final 10 minutes. Therefore, I would like not only to thank everybody, but again invite any questions, any comments before I give the floor to Maya Pakic, who is the Vice President of ESGO and who will draw some conclusions and bring us all together on a call to action, which derives exactly from the discussion and from the analysis and the work that has been done by ESGO collectively with the experts and the other stakeholders. Any burning questions or comments, please do not hesitate. Lorenzia.
I think I have a question for our EU personnel. I was just wondering if the burden of the gynecological cancer diseases is actually something really known, the data, the numbers. Because when you look at ovarian cancer, I remember when I started med school, we're talking about the survival rate being 20 to 40%. I'm 25, almost 30 years further, and it's still the same. It's still the same. And most of the women that suffer from ovarian cancer are actually in their prime. When you look at most of these women, they are in their 50s, 60s. That's when they are, you know, heading companies, doing, and that is when it strikes. And then 5 years, more than 70% of them are not there. Is the burden of these diseases actually clear? Because I get up and I still have to go in my free time, which I practically don't have, but I am, with this center that we set up, doing our free time, going to do outreach where, so is this burden actually clear to those in charge, those who have to make policy, those who have to make decisions? Is it clear? That is my question.
The question is very clear, and I think it is almost, if I can call it a rhetorical question, in the sense that we know the answer. And the answer is, in part, Europe's Beating Cancer Plan. Now I'm speaking on your behalf, which I should not.
If I may, colleagues, please keep in mind, they have different data, and different calculations, and different methodologies. We have different approaches in burden. OECD, WHO, European Observatory, you know, and different centers. Why? Till now, we do not have mandatory, that's on the same methodology-based statistics. Eurostat is never calculating data because health is not enshrined in Lisbon Treaty as an aim. Eurostat data is based on some articles which are enshrined in Lisbon. Why am I arguing about necessity to have more or less aggregated and the same on the same methodology-based data calculations? And now is window for opportunity, European health data space. It can allow us to go into and to collect and to have more or less more, based on the same methodology, presented to all member states, to all obligatory to present data, because otherwise the data would be in very different. We are in good track, and it is good opportunity now to raise. Economic burden is calculated in different areas of diseases. And it is true from your side, from different, but if we are speaking about aggregated European approach, we need to press to have, and European health data space creates one of windows of opportunity.
Great, thank you.
Thanks a million. Time is never on our side in general. Let's try to draw some conclusions and hear from Maya what are the next steps and what are the key takeaways for everybody. And then we close.
Thank you. Thank you very much. And first of all, in the name of ESGO, I would really like to thank again everyone to contribute in this discussion, very fruitful discussion. And yes, I would like to make two most important remarks or closing suggestions. First of all, ESGO believes that what we need first is infrastructure. If we do not have infrastructure, then we don't move anywhere. And by making infrastructure, calling for network of centers of excellence for women health, we would like to emphasize that, first of all, ESGO has done a lot of work so far, including other sister societies like ESHRE and EPCOC. So we already have some systems in place that work, and that work as an umbrella over all countries in European Union. And what we need now is to make it like a political priority and to scale it up. And we also would like to emphasize that when building the network of centers that work as one, we not only reduce inequalities and improve equal access to prevention, care, research in comprehensive manner, we also enable real live data to be collected in a quick and fashion way, as we already proved with our ovarian cancer database. And we also build resilience, as you said, and also build an infrastructure for research and innovation. So we really need a network that works as one, that is interconnected, and we have some experience already in place. And I would also like to focus on access. What we suggest is not only to have huge centers that are very rare. No, according to our quality indicators, what we suggest is to have one gynae oncology center per 1 to 2 million inhabitants. Why? Because in this regard, we are as close as possible to patients in geographical point of view. On the other side, we still have enough patients to have expertise and sustainable use of resources. So we are somewhere in between, not focusing only to bad centralization to only one center per country or something. No, we would like to be close to patients, but at the same time, of course, we have to consider expertise and sustainable use of resources. So we need infrastructure first. When we have successful infrastructure, we can do whatever we want. And the second conclusion I would like to emphasize is, yes, we really, really need to focus on women's health beyond cancer care, and it needs to be a political priority and, of course, associated with funding. And yes, in this regard, we will be stronger, because if we allow these discrepancies, as we heard from patients and as we know from data within European Union will be weak. It will be weak, and it will be associated with moving people from one part to another one, and with a lot of dissatisfaction, raising up policies that we don't want, that are not constructive, let's call it like that. And in this regard, I think we really need to call to focus on health, on women's health, on beyond cancer care and on cancer care, and to reduce these inequalities. Otherwise, we will be weak. Thank you very much.
Very concise, but very compelling, Maya. Thank you very much indeed. That's the call to action which we have all in front of us. And I would like perhaps to start with Romana Jerković. If you want to also share your thoughts, we are almost about to close. I also remember that both of you, Romana Jerković and Tilly Metz, are co-chairs of the Women's Health Interest Group. So that's a wonderful channel as well, or platform, to keep discussing these topics and going towards actionable solutions. Thank you.
And let me begin by thanking my dear Thank you, Eduardo. And let me start by thanking dear colleague Vytenis for hosting this event, and to ESGO and all the speakers for such an insightful and interesting discussion. You know, for us, policy makers, for me, there is nothing more motivating than hearing directly from the people with lived experience, from the researchers, from the clinicians who works with the patients every day. And your voices gives meaning to every policy, and reminds me every day why our work in European Parliament truly matters. So what we heard today was not really comfortable, but it is true, because women's health in Europe is still characterized by fragmentation and medical discrimination, and this is truly a systemic problem, and European Parliament recognize it as such, you know, a major gender inequality issue, and this recognition matters. But of course, it is still not enough. It is far from being enough. And I see it very clearly also in my work as a rapporteur for the European cardiovascular disease strategy. And someone said cardiovascular diseases are still the leading cause of death for European women. And yet women continue to be, as we also heard, underdiagnosed and diagnosed too late or undertreated. And this is a problem that I really want to tackle in my report that we are currently working on. I will share with you some interesting fact. I remember it was December of the 2024, and it was a Sant committee meeting, and we had a hearing with the Commissioner Labib, and I asked her whether Commission intends to work on women's health strategy. And the response was that this question I should address to Commissioner Varhelyi, who is responsible for the health. So the result now is that women's health became no one's responsibility, which is the worst thing. And as long as this remains the case, fragmentation will continue. And who will pay the price? Obviously, women again. So this is precisely why the MEPs, and especially, I won't say only one, because Tilly is also very vocal, very engaged. But from my S&D group, we have been very clear that Europe needs a dedicated women's health strategy, not as a symbolic gesture, and you explained very nicely, but as a concrete tool, you know, to organize policy, funding research, and accountability across the life course of women. So, and this strategy must go much beyond sexual and reproductive rights. It must tackle other very important things, such as chronic diseases and cancer, cardiovascular disease, and mental health, and menopause, and aging, and so on. So it must tackle the gender bias in diagnosis, in treatment, to close research gaps and ensure that prevention and also early detection actually work for women in practice and not only in paper. And let me conclude with a very simple message. We should welcome the progress that has been done till now. Yes, we have to admit it, but we should not pretend that it is sufficient, because it's not. And women's health is still without a dedicated plan and funding, and this lack of structure that you was talking about is not theoretical, but we have witnessed it play out in a practice. So if women continue to be diagnosed later, to treat differently and studied less, then gender equality remains incomplete. And if women's health continue to sit between the competencies and not in the center of one, then unmet needs will persist. And we need to work together, as you rightly said, to change the system. Thank you so much.
Yeah, I took a lot away today, and I think it's really Ramona said a lot of things that are very important, and it's not for nothing that created together this interest group on women's health, where we definitely need to act, because it's really about cooperation, it's about cross-party, it's about advancing equality. I must say I took a lot away from the topics that were addressed today. When I came in, even though I came late, sorry for that, I came from Luxembourg, I heard about the issues about fragmentation, and I found it also very interesting what Jalit said. Women's access to women's health, it's also an indicator of the health system as such, and also the need of a structured environment. From Lorenza, I definitely heard that the knowledge gap is still very, very present. And then also from Elizabeth, the need of funding, the need of what Romana also said, that we need this women's health strategy that needs to be done. And then from Marie-Anne, this was very interesting and very structured to hear the three goals that we need to focus on, so policy alignment, etc. I don't repeat everything. And then interesting was also what Wolfgang said about more also women in vulnerable situation, how to know that the center exists, how to get there. There can be mobility issues, it can be cultural issues. So I think also women in particular vulnerable situation is something we need to address much more. I was thinking when you were talking, and also the disparities among the countries. And then all the discussion we had, and I don't come back to that, to the competitiveness issue, but let me finish by saying something positive. I mean, it's about people that are committed, and I think in the SAMT and FAM committee, we have people that are committed, and there are things going on. Also, when you talked, we need data, Natalie, we need more data integration, and Vytenis said it, we have the European health data space, let's make it reality, let's make it work. We had now a vote on the Critical Medicines Act, guaranteeing really, and it's also about specific medication for women and contraceptive, etc., that we need to have there. Let's tackle the healthcare professional lack that we have. More than 1.2 million healthcare professionals are missing, so that's something else. And then the Europe Beats Cancer Plan that needs to be implemented, where we need to have a follow-up. And then I'm very happy that Ramona is the rapporteur of the cardiovascular plan, so that's also something we need, not to have nice words, but really concrete action. So there is hope. We are working and we are fighting, and that's why I'm so happy to work with all of you at the Commission level, but also the stakeholders and also my colleague from other parties to work on this topic. And thank you for all the interesting input you gave me, you gave us today. Thank you very much.
On behalf of ESGO in particular, whom we all thank for the initiative, I would like to thank Romana, Jerković, Metz, and Dr. Andriukaitis for hosting us and being with us today. Thank you all for participating and for your insights. Bye.